When it comes to medicine, it's not that simple, but no one denies it either. The one branch in medicine that literally boggles my mind, it would be psychiatry. Because brain, unlike any other organ, it's ever-changing, ever-evolving, and very sparkly and schizophrenic at the same time. It's interesting. So today I quickly want to tell you about PTSD. Unfortunately, more often than not, we suffer from PTSD as a condition, as a disorder once in our life. It's very common. It's that common, yes. It's the short form of post-traumatic stress disorder, and everyone has a coping system, a coping mechanism. But what happens when you undergo a very emotionally distraught and stressful event and you are not able to recover from it? The person is left with PTSD. PTSD can last for months or even years sometimes. And during this period, there can be triggers that bring back all the painful memories of the trauma, accompanied with intense emotional and physical reactions. It is so disturbing for the person that the person might slip into a panic attack. Treatment includes therapy in combination with pharmacotherapy. The best treatment for PTSD would be CBT, cognitive behavioral therapy. It's in fact a type of psychotherapy. Now what is CBT? CBT has two main components, exposure therapy and cognitive restructuring. Now what is exposure therapy? In this intervention, the person is gradually exposed to the trauma itself via mental imagery, writing, or visit to places or people that remind the person of the trauma in a safe environment. Now this is really important. Everything is happening in a safe environment. So over time, the person gets desensitized, become less sensitive towards the trauma. Now let us understand what is cognitive restructuring. Many a times, more often than not, people remember the trauma differently than how it happened. Yes, most of the time. And it's very common to have feelings of guilt and shame about the aspects of trauma that were not their fault. Cognitive restructuring helps people make sense of the trauma. It helps people look at what happened with a fact to get a realistic perspective of the trauma, and it decreases the feelings of guilt and shame and all the feelings that accumulate over time and start to suffocate. In a nutshell, CBT is a trauma-focused therapy. CBT focuses on identifying, understanding and changing our thinking and behavior patterns. It is very effective for PTSD. So to say, if you are stuck in your past, if you avoid certain people or place or some triggers that just send you in frenzy and almost give you a panic attack, remember, PTSD is 100% curable, and it's normal. Sometimes we just can't cope with the emotional stress. So anyone can have PTSD. It's 100% curable. Just choose not to suffer. Give importance to your mental health. It's as important as your physical health. Choose health.